It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
If you've ever wondered why your cycles are irregular, why your pain feels unbearable, or why pregnancy hasn't happened yet, you are not alone. PCOS and endometriosis impact millions of women, yet they are still misunderstood, confused, and often overlooked in fertility care. Today on Cry It Out Loud, we are joined by Dr. Angela Potter, fertility expert and PCOS expert specialist, to unpack the differences, the myths, and the realities of how PCOS and endometriosis affect fertility, pregnancy, and loss. Thank you so much for joining us today. Again, Angela, it's so great to have you on.
Oh, I'm thrilled to be here, Bernice. Thanks for having me.
Absolutely. So I would love just to dive in and talk about, what is PCOS and endometriosis?
Yes, this is such an important topic because it can be really confusing for women to understand, do I have one? Do I have the other? Do I have both?
Yeah.
So I'm going to help get some clarity there because they are, when we look at it from the medical perspective, they're very different. They're doing very different things in the body.
Yeah.
So PCOS is Polycystic Ovarian Syndrome. It is inherently, if we put a global kind of perspective on it, it's a metabolic and a hormonal issue. So when we're diagnosing PCOS, we're looking at ovulation issues. We're looking at androgen hormones like testosterone. Those are the male pattern hormones that drive hair loss, acne, weight gain, things like that. And then third, we're looking at cysts on the ovaries. So those are the three pillars that we use for diagnosis for PCOS. Symptoms, really common symptoms of PCOS are going to be irregular or absent cycles. That's probably the hallmark symptom. But then there's lots others. Women could have acne. And this is somebody who's, 25, 35, thinking, I thought acne, I left that behind in high school. Like, where is this coming from? Hair growth where you don't want it, like on your chin, your back, below the belly button.
Yes.
And then where you do want hair, like your head, it's falling out. Yeah. Weight gain, particularly around the middle, that's really stubborn. And, maybe you're gaining weight, even if you're not making any changes in your life. Poor sleep, energy issues. I mean, PCOS it's a full body experience. Okay. And you can get many symptoms in different parts. And that's why PCOS can be tricky. I had that full episode talking about PCOS. So to the listener, head over and listen to that one first, and then jump into this one because there's lots of different aspects to focus on for PCOS. So that's PCOS. And how does that differentiate from endometriosis? So endometriosis, again, let's start by looking at it from kind of that global perspective. Well, it's an inflammatory issue. Okay. PCOS, I called it a metabolic and a hormonal issue, where endometriosis is inflammatory. What's happening in endometriosis is the cells, similar cells to the uterus, are actually growing outside of the uterus. So it can be found on the ovaries, on the bladder, on the stomach, in the digestive system. And it really varies to how little it's grown or how large it's grown or the area that it's grown in. Okay. It might be really localized to just outside the uterus, but it could actually be all the way up in the abdomen, by the stomach and the intestines. And so the hallmark symptom for endometriosis is painful periods, like significantly painful periods. And when we're looking at, and I mean, somebody can have, any one of us could have a painful period, and it doesn't mean automatically that we have endometriosis. Okay.
Yeah.
There's a variety of reasons why someone could have a painful period, but the hallmark symptom of endometriosis is that pain.
Yeah.
And so for the diagnosis of endometriosis, it's a little tricky because a lot of us doctors, we want to diagnose something before we have to do something invasive. And with endometriosis, there's no definitive diagnosis just based off of symptoms or anything or any lab test. The definitive diagnosis has to be done by laparoscopy, which is when a little teeny scope goes in through the skin in to look at the pelvis and the abdomen to see if there's actually any endometrial tissue outside of the uterus. Bernice, what else?
Yes.
What else can we talk about those?
Yes. And it's really interesting as I know I was sitting here like, me too, me too, me too. So just to talk about myself just for a second and to overshare
Please.
with our listeners, I went into my doctor when I was 16 because I got my period later in life, menstrual cycle, and I was getting it every other month. It was very irregular. It was very heavy. It was also very painful. And going in and just threw a birth control pill at me, and saying, oh, this is normal. Everybody has painful periods. Just like, go home. Here's this. And I know we shared this pre-show, but I also, as a young girl, started getting hair on my chin, on my neck, a little bit on my chest, under my belly button, very staple things. And that really affects, a girl who, you're growing, you're a young teenager, you're trying to figure out life, and all of a sudden you have this hair and you're like, nobody else has it around me, or you don't think so, right? And you're trying to manage that, bleach it, all the things. And, bringing that up to doctors and not having this holistic approach with it. And that was like one of the staples, right? When, I was in my early 20s and got diagnosed with PCOS, and it was from having almost a cyst rupture, and they had to go in and remove it. And then they were like, oh my goodness, like, this is all like your textbook, right? And I was like, oh my gosh, like, finally. And when someone explained, and the doctor explained to me what PCOS was, it was like I had this aha moment. But there was also like, I knew something else was going on. And it wasn't until we went through one of our births that we found out that I had endometriosis, and it was from having all of that tissue, all around. And they were like, oh my goodness. And then also just other scar tissue that was forming, different things. And it was like, wow, this finally like explains also, like, I would gain weight in my midsection, only my midsection when I would gain weight. And it was all depending on the week of the month. And like, that was really weird too, like where I would have like more bloat than not. And, nothing was ever explained to me. But then also the painful periods and getting them under, like, how you can get them under control, what you can do. And it was like, finally, like, I understand why I've been having this, because nothing was working, but I could also then be able to focus on different things like, nutrition and that kind of stuff, and what I needed to do for myself, and hormone level and regulation. I think understanding that and what was happening within my body, like you were sharing, and honestly, having the both of them, it's like, how do I, figure this out, and what does that look like? And it really did cause secondary infertility for my husband and I, and trying to navigate that and what that looks like. And I couldn't, say more about getting extensive panels done, figuring out, what's maybe lacking, that you can take like supplemental wise and things like that for this. And, after getting that under control, it really did help, in a lot of ways.
Yeah, I mean, what a journey you've been on, Bernice. Thank you so much for being open about that. And yeah, I'm so glad that you brought that up, because, one big reason why you and I are here today is to talk about how PCOS and endometriosis, they happen in the same body. It's not that just because you have PCOS means you're not going to have endometriosis, and vice versa. And, I see it a lot together. Say endometriosis and Hashimoto's thyroiditis, those are the top two co-issues that I see with PCOS. And, it can be tricky. And so particularly if you have both. And what I see is that, because I'm a PCOS expert, and so women are coming to me saying, I already know I have PCOS, or I have all the hallmark symptoms, like what can we do for my fertility? And that's what we're working on, which again, the focus is going to be working on hormone regulation, working on clearing cellular static. And so hormones can speak to one another, things like that. And that, of course, is helping the PCOS picture, but then the endometriosis picture kind of, when I'm working with clients, what I talk about is our health is like an onion, and peeling back the skin layer by layer can reveal more things. And so when we're working on the PCOS side of things, then that endometriosis can not appear, but it kind of rears its head more or less. And it's like, okay, so there's also this picture going on. So we've got to really, PCOS does have an inflammatory aspect to it that's really important. So we're paying attention to that inflammation with PCOS, but with endometriosis, it's fundamentally an inflammatory issue. So we've got to take that to the next level to help lower the inflammation in the body to get that tissue to calm down.
Absolutely. And it's interesting. Like I felt like too, like you were saying, those onions, right? Like once I could, like it really did. Like I knew something, once I knew I had PCOS and got a decent handle, or tried to at least, then yes, it was like I intuitively knew something else was going on. And like, 'cause, we're taught from a young age to know our bodies and to know our cycles, and you just know. And so it really is. And then rearing its ugly head and getting, inflammation. I had no idea how many like foods, like supplements I need, different things that were causing even more inflammation, and like just how it would affect your body overall.
Yes.
Yeah.
Like, because it's not just about the uterus. Is that what
Yes.
you're saying? Like, it's
Yes.
affecting you on this whole
Yes.
body perspective.
Absolutely. Yeah, absolutely. And all
Mhm.
over, and just really understanding how and what works for you and what doesn't work for you and what's needed. And, it's just, yes.
Yeah, that's so key, Bernice, to bring up that piece, because when we're talking about PCOS or endometriosis, one of the biggest issues, which actually we're getting into a little bit of the misconceptions, which we were going
Yes.
to focus on in a minute, but um, is that if the doctor or the healthcare practitioner is highly focused just on this, one track vision of with PCOS. Well, let me say this, with PCOS, it's just about getting the egg out of the ovary with
Yes.
ovulation induction medications, or with endometriosis, it's only about getting those lesions gone via
Yes.
surgery, which is
Yes.
very important in both cases, right? You want the lesions to go in endometriosis, and you want the egg to ovulate in PCOS. But
Yes.
if your healthcare practitioner is focused only on those things, they're completely missing the mark,
Yes.
because fertility is a whole body health issue. Like, you can't just focus on those one vision things and expect that your fertility will bloom. And,
Yes.
what I've really started talking about with people is the fact that, when you're having struggles with fertility, it's fundamentally not a fertility issue. It's a biological safety issue, because the body is in PCOS, it's having issues with hormones, the insulin and cortisol and inflammatory markers. They're all going crazy, and they're not talking to one another, and the
Yes.
brain is not able to talk to the ovaries. That is all going on. And with endometriosis, there's these lesions growing outside of the uterus that the body's like, what is why do we have this going on? And that sets the body up to say, oh my God, it puts it on high alert and
Yes.
thinks the body is in danger. physiologically, because we know that over, since the beginning of human history, our bodies respond to stress and danger signals in the exact same way. So right now, our bodies respond to the stress of high insulin or having endometrial tissue outside the uterus just the same as it responded to getting attacked by a lion 100,000 years ago. Okay. So the body is in this state of panic and protection. So actually, the fact that it's not getting pregnant is your body working miraculously to protect you. I mean,
Yes.
think about that, just that mental shift. And
Yes.
it's more about shifting the body and looking at it from this holistic perspective to shift it into this biological safety where the green light is on for fertility. It's saying, yes, I feel calm, I can rest, I can digest, and I am ready to make a baby. And
Yes.
so that's absolutely the key right there, is to take that whole body approach rather than just getting that tunnel vision.
Right. And it really is like, it's like self-preserve, like it's really protecting itself. When you were saying that, I was just like, yes, Dr. Angela. And it was, interesting because I go back to, and this is what I said during, like, when we were actively trying to conceive and dealing with secondary infertility and everything. I was like, what is causing, like, what is the root cause or what is affecting this? And it was really hard to get any answers. And I, just listening and things like that, I was like, well, let's do this surgery, let's do this medication. And it's like, that's not an answer. Like, that is just a throw a Band-Aid on it resolution for right now. But when you look at, okay, we remove the lesions, we remove the tissue, we remove the cysts, we, do all the things. Okay, but it's going to come back. And so, like, how can we prevent that, or not prevent it necessarily, but even keeping it like at a slower rate or whatever. And it was like, where's that evidence-based medicine for this? As in, how, what can I do or in myself, in other ways that's more holistic than the chemicals of, different medications.
Yes, exactly. And I think more and more people and women are standing up to say, okay, we don't want just the Band-Aid solution anymore. Actually, I want this to be taken care of, but I want to feel healthy and vibrant in my body. And, it's not that the medications are bad or that we should do a complete 180
Right.
shift
Right.
away from that,
Right.
because for many families that those, medications or like procedures like IVF are the ticket
Absolutely.
that get them across the finish line. But I think,
Absolutely.
what you and I are talking about is the fact that, one, that people are being recommended those things super early on, before
Yes.
that conversation of like, well, what is the root cause? Why did these lesions grow? Or why do I have the cysts? And you got to have that conversation first. And
Yes.
it gets you to a point where it's like, okay, you've done all this, but we do actually need to do the surgery to get that
Yes.
endometriosis out.
Yes.
And but that you're supporting your body on those multiple levels, so that you're actually, yes, like you're focused on bringing baby into the world, but you're saying, but I actually want to reach a little bit higher and feel good in my body, and wake up ready to grasp the day.
Absolutely. Because, like, the disrupted sleep that comes along with this, and just like feeling like you're running a marathon every day, it's like, oh my goodness, just exhausting. At certain points and
Yes.
things like that. So yeah, any way to get there. And and it is making those informed decisions, like having
Ooh.
everything laid out in front of you, and then you making what is right for you and your partner and, your future and things like that, but really being presented everything so you can see it and understand, okay, these are my options, these are my steps, and asking those critical questions like you were saying.
Yes, so
Absolutely.
powerful.
Yes. So yeah, that takes us right into, the misconceptions of PCOS. And this I cannot wait to hear as well. So
Yes, yes. Well, so, I think we kind of covered that, the first one I was going to bring up, which
Yeah.
is you can't get pregnant without medications.
Yes.
So, in the fertility world, from a doctor's perspective, right, there are treatment algorithms, and the PCOS algorithm is to give up to 5 rounds of medicated cycles, and if none of those work, then move that patient forward to IVF. So that's the trajectory for PCOS. And so, of course, that's going to lead so many women to think, well, medications are the only answer for my PCOS. But as you and I just really hashed through, no, it could be one aspect of the journey, but you've got to take that holistic, whole body perspective to really get your body to the next level.
Yeah.
Okay, so then let's jump into the second misconception, and that is you have to lose weight in order to get pregnant with PCOS. And this one, it just breaks my heart.
I know.
Yeah.
I feel that so
And
much.
right, there is so much misinformation out there that someone, and I speak to this because I've spoken with hundreds and hundreds of women who have PCOS, and they're telling me, well, my previous doctor, they said, well, once I lose 20 pounds, 60 pounds, then everything's going to happen for me. And I've tried it. I've gone on restrictive diets, and I'm not pregnant yet, and I'm miserable. I'm starving, I'm exhausted, I'm stressed out, I'm losing my hair. And that what's happening is that the standard medical information of just lose weight in order to get pregnant, it's completely missing the mark, because it's, again, that tunnel vision on only one aspect of that person. And, sure, we know that weight loss can help with certain hormonal markers, but for somebody who tends to hold on to some extra pounds on their body, can make those markers move without the focus being on the weight loss. And when we focus specifically on the weight loss, then we forget about egg quality. Well, not we, I don't forget about these things, but the other doctors who are saying just lose weight, they're completely disregarding the fact, well, we could actually provide this person in front of us with the nutrition recommendations to support egg quality and how to set up a nutritious daily food rhythm that is walking them straight forward to baby. What research-backed supplements are support egg quality, and how can I help this person in front of me be supporting their egg quality? Because we know that people who hold on to extra weight get pregnant. Weight
Yes.
is not just a closed door to pregnancy. No, not at all. And so that's, really, but in the PCOS world, that conversation is had over and over again. And I just want to say it's less about the weight, and it's more about looking at your nutrient markers, looking at your hormones. Well, if you don't have progesterone, it doesn't matter what the number on the scale is. I really don't care what the number on the scale is.
Yes.
I want your progesterone to rise. So how
Yes.
am I going to focus on that?
Yes. Oh, Dr. Angela, and you sang
Yeah.
that. So, after we had our daughter Brooke, and she passed away, which we talk about in
Mhm.
our episodes and stuff. We went on a couple months later to get pregnant with our rainbow baby, and we thought we were going to struggle because of my weight, because that's what we were told
Mm.
all
Oh
of
my
that
gosh.
time. And to get pregnant, with Brooke and our rainbow and things, we did have to do progesterone shots, which is, what
Mhm.
got me there because of my levels, but it was being
Right.
recognized by someone who was taking that delicate approach and realizing that was it. Because I don't know how many times IVF came up, IUI, which, is needed sometimes. But then once we did those, it was like, boom, that was like all my body was just lacking.
Right. And it wasn't the weight piece, was
No,
it?
no,
Yeah,
no. And it was
not
like,
at all.
I felt, because like I'm already having so much body shame. I'm already feeling like my body's not doing the one thing that we're taught from a young age to be able to do is have a baby. And like as a
Right.
woman, like I'm feeling like I'm failing myself, failing my partner, have all
Yes.
this like, oh, if I could just do this or this or this. And it's like, and then like, how do you not want to comfort eat during those times? Like, I mean, I can't help myself. Like I'm
Right.
like literally feeling bad. And then like starving, and then like you get to a point that you're like, I'm just going to eat everything now at night because like I was trying all
Mhm.
day to be so good, but you just can't help, like it really is like a vicious cycle, and it's very misconstrued the way that it can be talked about or said to. And like we're already putting so much pressure on ourselves. Like the last thing I need to hear is like,
Exactly.
especially as a woman, body image issue, like don't need you to say that, like please don't, like
Mhm.
there's other things. And so that just, I appreciate that so much.
Yeah. Oh, thank you so much for sharing your personal story with that because, yeah, I think that'll help really drive in that fact that, yeah, we need to look at so much more than just the weight piece.
Yeah, absolutely.
So let's then talk about the third misconception, and that is that you can't get a regular period when you have PCOS. So the hallmark, of PCOS is irregular cycles, absent cycles. I work with women who haven't had a period in the last year or 3 years, and they, and the misconception, you can't get a natural cycle on your own, right? Birth control is the only way to regulate your cycle with PCOS. Okay, that's the misconception that we're going to
Yeah.
cover here.
Yeah.
And again, birth control as a tool is exactly that. It's a tool, but
Yes.
it's created to stop someone from getting pregnant. It is a form of contraception. And so now that we've moved into this period of medicine where we use it to regulate periods with PCOS, because for someone with PCOS who has irregular periods, birth control, hormonal birth control, the pill, I'll be specific with that,
Yeah.
is the treatment for it. And one, that's basically dismissing a woman's body to say, yeah, you can't do this on your own. Sorry, we're just going to give you these fake hormones, which again, the fake hormones aren't bad. We need them if you're trying to not get pregnant.
Yes.
But for you listening, if you've got PCOS and you want to get pregnant, you don't want to be on contraception just to regulate your periods.
Yeah.
And yet it gets in the psyche that birth control is the only answer.
Yeah.
But what's happening is that birth control, it's a synthetic or fake version of estrogen and progesterone that you're taking. And what that does is that it just blocks your brain's communication system with the rest of your body, because that's what it wants to do in order to stop you from getting pregnant. So it stops the complete cascade of your body moving into any sort of fertile mode, because it blocks hormone messaging, it blocks your brain from speaking to the rest of your body. That's what it's doing. So
Yeah.
from an outside perspective, the fact that you're getting a bleed every 28 days, it looks really nice. It looks like, oh, wow, actually my body is doing what it's supposed to and I've fixed it. But that's not what's happening internally. And that's the disconnect, particularly when somebody comes off of the pill and is like, whoa, hold up. Like, I thought I was just going to be ready for baby, but now my period hasn't come in the past 6 months,
Yeah.
or it's really irregular. I was told that birth control was supposed to fix everything, and it doesn't.
Yeah.
And, what needs to happen, because in my practice, 9.5 times out of 10, the women working with me are getting their periods back, and they're getting them back consistently.
Mm.
We've got to look at the wisdom of the human body. And because having a menstrual cycle, a regular cycle where you get a period roughly every month, is the body's natural resting place for someone who has female organs. It's just that.
Yeah.
And so trusting that innate wisdom that we've got to figure out why. Okay, what is the driver that is keeping this particular person from having regular periods? Because it's there. And, I talk to so many women who are saying, well, my doctor told me my labs are normal, so I don't really know what's going on. They're telling me they don't know what's going on. And I'm just like, I want to hit my head on a wall because from not because of the person telling me this, but because another doctor has told that person, like, well, your labs are normal. No, your labs are not normal. I can tell you that without even looking at your labs because you're not having a regular cycle. So physiologically, we already know that there's something off, that there's at least one hormone or, a nutrient, something is not going to be normal on your labs.
Yeah.
And so from my perspective, it's just about finding that. It's about reading those labs from a thriving perspective, not a surviving perspective.
Yes.
That's another issue, is so many doctors are reading labs from that survival perspective.
Yes.
Not going to help you when you want to have a baby and you're having trouble getting pregnant. So you need that thriving perspective. And so just that's what I do, is help this person figure out, well, why is it that you haven't had a period in the past 6 months? Usually it's an issue with cellular clearance, or there's too much static in the body. The hormones can't speak to one another, or maybe it's a nutrient issue. But that's what we do in order to bring this person to a place where she's able to have regular cycles, to ovulate and be set up for baby. So it is not true that someone with PCOS can't have a regular period on their own without birth control.
Yeah. Oh, Dr. Angela, thank you. Yes. And
Yeah.
I mean, just from my personal experience, now I have regular menstrual cycles. I mean, they're still very painful, and I try to monitor them as much as I can. But yes, like, I feel like once you do have a control, or can at least understand what is happening, you can make so much more like informed decisions about yourself and what to do from a month-to-month basis. And just, yes, it really does like open your eyes to so many other things. But isn't it true too? And I'm pretty sure we discussed this in your last episode, that it could even be like other things like your thyroid, different things like that, and necessarily not down, in all your baby making area. It could be somewhere else that isn't being found or looked at.
Yes. Thank you for bringing that up, because and that goes back to that. Fertility is that whole body approach.
Yes.
And when I'm talking about, there's static in the hormonal messaging, it's not just about the progesterone and the estrogen. No, we have many hormones in the body. They are all talking amongst themselves. And so if you're not looking at the thyroid, or not looking at cortisol levels, or not investigating insulin levels, and just looking at a glucose level, like, those are all missing pieces that are going unnoticed and untaken care of for someone. And we've got to do that, because, over and over, I see someone, again, will come to see me and is like, well, I've been trying for the last 6 years, haven't been able to get pregnant. And I look at their labs, they haven't had a thyroid panel done, and particularly not a complete thyroid panel done. And I'll run that and I'll look at their cortisol, and I'm like, right there, I can tell you, this is why you aren't ovulating. And, and then we work on that, we fix that, and they're pregnant in another 2 to 3 months. And so thank you for bringing that up. It's absolutely looking at all the different systems.
Absolutely. And I feel like the hormones in our bodies are such a puzzle, right? And if the pieces don't fit perfectly together, it's not going to be that big picture, and the puzzle's not going to be complete. And it really does need to be, honestly.
Yes, right. And, because it's a puzzle, I love that analogy. You don't want
Yes.
to do that on your own. You don't
Yes.
want to be putting these pieces together because I also talk with a lot of women who are saying, I feel like I've tried everything. I'm on this list of supplements. I've tried a couple different diets and I really want to get pregnant. I really want to feel healthy, but I feel like I've tried everything. What else is there? And when they read their list of supplements, maybe they're on a prenatal, vitamin D, and CoQ10, all really well research backed supplements, right?
Yes.
You could
Right.
go right now and find a bunch of research studies on the benefits of those. But what's happening is that they aren't specific to what's coming up for that person, of
Yes.
why she isn't ovulating, why she doesn't have a regular cycle right now. And
Yeah.
so trying those supplements is just like, or trying to put those puzzle pieces together yourself. It's like
Oh,
throwing spaghetti at the wall. Like,
yes.
I really hope this is going to stick.
Yeah.
But when you want to get pregnant, you don't want to be in that mindset of, let me just see if this is going to work. Maybe this one will work. No, you want a roadmap. And you want
Yes.
to know particularly what your own physiology is saying that it needs in order to get you to a place where you've got that green light on and you're in that biological safety to say yes for baby.
Absolutely. And you're so right with the blanket things, like I don't know how much money over the years, prior to finding an individualized approach, did I spend on supplements that, were research based? Great. But it wasn't individualized to me. Like these supplements, everybody, could take or anybody, they were on the market, but it was like what particularly maybe I'm lacking or needing more of or changing it up to fit me as a person. And having someone to navigate that with is so important that I'm not just guessing off of what I find from research. Because, like I said, I don't know how much money and time was wasted. And as we know, too, with fertility, we already feel like we're on an egg timer. And so,
Yeah.
however we can, do right by ourselves to get to baby is just so important. Yeah.
Yes. Yes.
Oh, Dr. Angela, what would you love to leave our listeners with in this episode?
I want to leave you, regardless of if you have PCOS or endometriosis or both, I want you to walk away today knowing that your body is not broken.
Mm,
Your body is actually working in this miraculous way to protect you right now. And it's just not ready to be pregnant yet. You have to figure out what it is that's going to move your body into being able to switch on that green light for pregnancy.
mm,
So know that you're not broken. Okay. You just have to find that missing link so that that green light switches on for you.
mm. Wow, it's so powerful. Thank you, Dr. Angela, for that. Thank you for being here, for talking about the differences, the misconceptions, and really defining what it is and the symptoms that can occur with it. It really means the world to have you.
Oh, well, thank you for having me. It's just wonderful to be here with you. And I love talking with you.
Absolutely. You too. Thank you. For our listeners, your pain is real, your cycles matter, your fertility journey matters and deserves answers. Whether you are trying to conceive, navigating infertility, or grieving a pregnancy loss, any type of baby loss, you are not broken, you are not alone, and we are here for you. Thank you so much for tuning in, and please reach out on chasingtherainbows.org if you need help and support or looking to volunteer. Thanks again.